Hi again. This is Dr. Thomas Rocco. I'm from Back to Basics Medical CBD Consultants out of Warwick, Rhode Island. We have a website, www.backtobasicsllc.com. That's BAK number 2, basicsllc.com. Call us with any questions. This live Instagram is really to help people understand CBD as it relates to medical illnesses and how it could meet your needs. So today we're going to talk about a simple concept, but people don't know about it. It's about different types of descriptions of CBD. It can be described as either an isolate, as a broad spectrum, and as a full spectrum product. And it can be very difficult to understand the differences between those different types of descriptions. And it's very important to know those because certain ones are important for certain issues, and other ones really is important about drug testing. So when we talk about different types of CBD products with patients, one of the first things that I do ask them is, are you concerned about any drug testing? And with drug testing, you should not take any type of full spectrum medication. It has a small amount of THC. It has less than 0.3% THC in the product, which if you take even a simple dollar drug test, we have them here actually in the office, simple drug test, there's a good chance it'll show presence of THC. So that's really very important. I have patients that are concerned with CDL licenses, with active military police officers. So it's very important to know if there's THC in the product. So full spectrum medications has all the contents in the hemp product. And you're going to get mostly CBD, which is about 99.7% or more of CBD. There'll also be terpenes in it, and that also gives you kind of aroma to the product, and also has different terpenes, have different help with different medical issues, and we'll go over that a little bit later. And then with full spectrum, you have a small amount of THC. It's less than 0.3% that allows a patient to buy this without needing a medical marijuana license. Now with an isolate CBD medication, it is 100% CBD. There are no terpenes in it, and there is no THC in it. We have two products that are 100% THC, terpene-free that we use for our medicine, and one is a tincture, and the other one is a lotion, which we use for local muscle and joint pain. So those two types of medication are important to know. If you ask me which ones work better, it usually is the medications that have the THC in it because of the entourage effect of THC and CBD and how they work in the same receptor sites within the endocannabinoid system. Then there's a third type that's called broad spectrum. That is essentially THC free, but it has CBD in it, and it also has terpenes in it, which can be helpful too with certain problems and medical illnesses. We have one product that is a BioFreeze roll-on. So that is a type of medication that if somebody's worried about drug testing, they could use that as well. Technically, if by our lab results from this broad spectrum medication, it has CBD, it has terpenes, but it has no THC, and there's no concern of drug testing issues with that type of product. So if you're somebody that has no concern of drug testing, I would always recommend a full spectrum medication because it has everything in the hemp plant that's helpful and with medical illnesses, and that's again a small amount of THC, less than 0.3% THC. It will not cause any psychoactive effect, no high to it. It has terpenes in it, and it has mostly CBD products in it. Then there's the isolate, which is just mainly CBD, nothing else. You have CBD product, they've distilled it so it's clean, only CBD, only without any THC, without any type of terpenes that are in it. Then you have a broad spectrum, which kind of in between the two. And again, you can use this if you were concerned about drug testing. It is CBD with the terpenes, but absolutely no THC. At this point, there's more isolate products and there's more full spectrum products. There are some broad spectrum products, but not as many at this point. So when we're looking at, again, the medications, when you have a CBD isolate, it is pure CBD, but it's also important to know that there's different types of CBD that help different types of illnesses. So there's CBD, obviously, everybody knows about CBD. There's CBG and there's CBN. Honestly, in my experience, products and patients that need a CBD type of medication more for sleep, you find that you need more CBG and CBN type of cannabinoids in that product. So we have something like that. So we have a medication and it's called Echo Drops Dream. This is a full spectrum medication. So what this means is it has a small amount of THC. It has some terpenes in it, which helps with the aroma, and certain terpenes help for certain medical illnesses. And then it also has CBD in it, but it also has CBG and CBN, which helps with helping with sleep. So there a lot of different products are specialized for different types of issues. So it's really important to know that. The medications that I mostly use is mostly for pain. And with pain, honestly, CBD is the medication, the cannabinoid that works the best. And again, I believe that the CBD with the small amount of THC, because it works at the endocannabinoid receptors at the same area, are a synergistic effect and will help each other with a better effect. When you look at the dose and effect of CBD, it is a bell-shaped curve. But when you use it with a full spectrum product with a little bit of THC, and I'm sure the terpenes add to it, the bell-shaped curve is a little bit higher. And again, they call that a synergistic effect or entourage effect. Therefore, when we talk about dosing, if somebody is using a full spectrum product, we have a certain dose that we recommend. For adults, for anxiety, quickly it's 15 to 20 milligrams. For pain, it's about 20 to 40 milligrams. For sleep, it can be 50 milligrams and higher. But if you use an isolate medication and there's no THC in it, or a broad spectrum medication and there's no THC in it, and there's no synergistic effect, no entourage effect, normally you start at that dose, but there's a good chance that the dose might have to be a little bit higher for that to have the same effect as a full spectrum product. So those things are very important. That's why with all the products that we have and any products that you would buy, you should get the lab results so you can look at not only do I have an isolate product and there's no THC in it, but what types of CBD are in it. Is it just CBD? Is it just is it have CBNs and CBGs that help with sleep? So those things are things that we're still learning about, but in my own experience, it's important to have the lab results to describe to patients which type of CBD medication will be helpful for you. My patients I mostly work with is mostly for pain and anxiety, and then we use it for sleep. And then there's patients just for general wellness that they take a capsule once or twice a day to help with their inflammation throughout the day. So it depends on what you're looking for, what type of medication that you need. Am I worried about drug testing? So again, what's important to know is full spectrum CBD products have a small amount of THC in it and can show up on drug testing. That is very important to know for active military patients, people that have CDLs, people that have captain's license, people that drive trucks. This is really, really, really important to know. If you take a CBD product that's a broad spectrum or an isolate, there's no THC in that product and should be absent with any drug testing. But what's more important is if you do purchase CBD, lab results should be available so you know this 100%. Every product that we offer has a lab result that we can print for you, has a lab result on our website. So it's easy to know. You look at this product right here, which is Real Scientific Hemp Oil, RSHOX. This is 100% CBD. This is the most common medication I use for patients that are concerned about drug testing. It's a very good drug. Company's well recognized. It's in the physician desk reference, the only company in that physician desk reference. And when you look at the lab results, it shows CBD only. There's nothing else in it. There's no THC in it. There's no terpenes in it. It's purely CBD. Whereas when you look at a medication like something like Rixmix, which is excellent for pain, it's excellent for anxiety, the lab result's going to show not only the different types of CBD subtypes in it, but also it's going to show that small amount of THC. So if you were doing a drug test and you were using Rixmix, the drug test will show that there's presence of THC. What's interesting, and actually brought to my attention by one of my patients who has a CDL and got a notice from the Department of Transportation. This was in November of 2019. We have it on our website, the notice, but what's interesting about it, it's what they say is it's very, very clear that if you do a drug test and the THC is present in the drug test, your explanation for that drug test of being positive THC cannot be that you're using CBD medications. So it is very straightforward in the description of how the Department of Transportation in this country feels about positive THC results. So it's really important to understand that when you're taking the medication, that you understand that there's only CBD in it, or is there CBD with a small amount of THC. So it's very concerning that you can buy this medication anywhere. You can buy it at a liquor store, you can buy it sometimes at a pharmacy. I've seen it at gas stations. Obviously it's at vape shops. There's CBD stores everywhere. So it does concern me if you are concerned about drug testing. So this is something that's really important. So when you look at which medication I should use, there's really three categories: isolate, broad spectrum, and full spectrum. And for me, if drug testing is not an issue, that is the best product with the best effect in our experience and in studies that I've read. And because of that entourage and synergistic effect. What happens there is, within the endocannabinoid system, there are two receptors. There's CB1, CB2. CB1 is mainly in the neural tissue, the brain tissue. That's mainly where THC kind of stimulates, affects. Then there's CBD2, which is mainly in the neural tissue, but also in our immune system. Most of that neural tissue is in the periphery. And so CBD mainly affects that CBD2 receptor, but they do work at each other's receptors. But when you have a pure CBD medication, it's really only affecting CBD2 receptors and a little bit of CB1. But when you have the full spectrum medications, what happens is you get that synergistic effect because it's working at both of the receptor levels and it's working together. My analogy to my patients is when you're taking an antibiotic just one antibiotic, it's going to have so much an effect. But when somebody has a really kind of a septic shock, they have a very bad infection, they have a septicemia, we don't usually treat it with one antibiotic. We use more than one antibiotic. And what happens is use antibiotics that work at different levels of the bacteria, so it has a synergistic effect. It's the same thing with the full spectrum medication. It's going to work at two different receptors, CBD1, CBD2, and your effect is going to be higher. Again, having that small amount of THC is going to have no psychoactive effect to it. It gives you no high, but it does give you a bigger effect when it comes to the medication, the mechanism of that product. So it's really important to know what type of medication you're taking. So patients come in and they're using isolate medications and it's not working. My first thing is to start moving the dose up, because again, you're not getting that synergistic and entourage effect. And that is really important to know. And my patients that use the isolates will start at the dose that we normally recommend, but there's a very good potential that we need to increase that dose. So those are the things that are very important about knowing the medications you need to use depending on drug testing. Is it an isolate? Is it a broad spectrum? Is it a full spectrum type of medication? Medications that we offer, all of our capsules are full spectrum medications. So we have a 10 milligram, a 30 milligram, and a 50 milligram capsule. So people that are worried about drug testing, I tell them they cannot take those medications. With the tinctures and the oils, most of them are full spectrum medications. We have one that's an isolate that works very well, but the other ones are all full spectrum, meaning that they have THC, they have terpenes, they have CBD. So back to the medications with the full spectrum, we have two other ones. It's Boost and Focus. Again, the terpenes and the CBD are specific to help with Boost, which is the mood, and Focus to help with your focus. So it's this type of company has kind of differentiated different CBD terpenes to help with different type of medical illnesses. Also, again, we already mentioned Rick's Mix. Rick's Mix is kind of a derivative of Rick Simpson oil. It's very good for pain. It's very good for anxiety. It has a small amount of THC. It has CBD. It has terpenes in it. And that is this medication right here, Rick's Mix. The last really full spectrum medication we offer is Relief. Same company, again, it's a full spectrum medication that has CBD, it has a small amount of THC, it has terpenes, and the CBD and the terpenes are specific to help with inflammation, with pain. So for me, if somebody's not concerned about drug testing, they're in a lot of pain, I usually recommend taking capsules during the day, using tinctures as needed, specific to what they want. If it's anxiety, we would use the capsules during the day and Rick's Mix as needed. If it's for pain, take the capsules during the day and either use Rick's Mix or the Echo Drops Relief. Again, there's medications we have specific that are full spectrum for mood, for focus, and for sleep. So those are the things that we can help patients with. And again, what's very important is concerning about drug testing. Full spectrum medications are not the medications you should be taking. You should be taking isolate medications. And if you have drug testing, you need to get the lab result or the research results of that medication prior to using it. Because a small amount of THC, even 0.3% in your medication, can show presence with any drug testing. Even a simple little dollar drug testing test that you can get anywhere. So it's very, very important. Everything that we offer, we have instructions for, so that when you get the medication, you know how to take it. We always give a dosing guide. We give instructions for all of the medications that we have. We want to make sure that you start at the right dose, start it at a lowest dose possible, and then increase it as you need to. One quick thing is, with CBD, the reason why there's very minimal side effects to it is because, again, we talked about the endocannabinoid system. We talked about how it affects the receptors. But what CBD does, it doesn't bind to the receptors. It boosts those receptors, so the immune system's working better, the neural tissue's working better to work against inflammation, and it lets that receptor work normally. And so that's why there's very minimal side effects to CBD as compared to, say, THC. What THC does to these receptors is it binds to it. And by binding to it, it doesn't allow that receptor to work properly. And that's why THC at higher doses is going to give you a psychoactive effect, give you that high effect. In fact, there are studies that show that if you overdose on THC, and that happens with edibles because you're taking it and you don't know how much of the effect you're getting, you might take it again. You'll find that taking too much THC, you might get paranoid. You might not feel right. And the best way to counteract that is actually taking CBD medications, because it's going to work at those receptors to help kind of relieve that THC effect. So that's one way CBD can be helpful, is somebody that's taking too much THC by accident, usually happens with edibles because it's hard to control, is using a CBD medication because it works at the same receptor level, and it will make that THC effect be less. But that's why CBD has really very minimal side effects. The side effects they say, are dry mouth. I think people have gotten diarrhea from it because if they use too much of the oil and they don't let it absorb and they just swallow it, it could act like mineral oil and be a laxative. And when you take it at high doses, 150, 200 milligrams at a time, it could make you sleepy. And that's what the kind of the dose that you would use for sleep, about from start at 50 and you can go up to 150 to 200 milligrams. So that's why the CBD is very safe. It's because the side effect profile is very minimal. It doesn't bind to the receptors. It makes the receptors work better by boosting our immune system, by getting rid of inflammation, by our immune system being boosted. Unlike, say, narcotics, even THC that binds to the receptors, doesn't allow the receptors to work normally, and then we get the side effects of either the psychoactive part of it, even constipation with narcotics, and the paranoia. So what's really important here is about the CBD product description. In review, there's three major types. There's isolate, there's broad spectrum, and there's full spectrum. Full spectrum has everything in the hemp plant. It has CBD, it has terpenes, which are very important in treating our medical illnesses and can be very specialized in what you're looking for. It has a small amount of THC, less than 0.3%, for you to be able to buy this without a medical marijuana license. Broad spectrum medications are CBD and the terpenes, but no THC in it, and broad spectrum medications should have no presence of THC with drug testing. And then you have the isolates. Isolates, it's only CBD, there's no THC, there's no terpenes in the medication. Again, an isolate and a broad spectrum, if you are drug tested, should show no presence of THC. The most common ones that are sold right now by these CBD companies are isolates and full spectrum. And if you ask me which I would recommend if you were not concerned about drug testing, I find that the full spectrum medications do have a better effect at a lower dose because of the synergistic effect or the entourage effect of THC and CBD at the endocannabinoid system, at the CBD1 and CBD2 receptors in our neural tissues and our immune system receptors. So it all depends on what you're looking for, how you need to use it, what medical illness you need. The terpenes and the CBD, or the cannabinoids, are very specific for different medical illnesses. So if you're looking for a certain type of need, that's where you have to see which medication that you would work for you. Rick's Mix is great for pain and anxiety that we offer. Echo Drops Relief I would use mainly for pain, muscle spasm pain, headache, migraine pain. Echo Drops Dream obviously has those CBG, CBNs, like those cannabinoids. It helps with sleep. The other medication, the tinctures we have, the Focus and the Boost, are specific for focusing and for people's mood. The isolate medication that we have is just safe for people that use it who are concerned about drug testing. That does help with pain. It does help with anxiety. I think with sleep, it has to be a very high dose. You might have to start at 100 milligrams because of there's no being an entourage or synergistic effect. My patients that use it definitely feel the effect, and we have used a little bit higher dose than we would with a full spectrum medication. All the capsules that we offer are only full spectrum. Unfortunately, we have no isolate capsules at this time. So that's why if somebody was taking any of those medications or any of these, we are very concerned about drug testing issues. I hope this helps you understand CBD product description. We have more information on our website. It's at www.back2basicsllc.com. That's BAK2basicsllc.com. We're on Instagram, obviously. We're on Facebook. We're on Twitter. We're on YouTube. We're here to help you with any of your questions. You can also call us at 401-678-6420 for any questions. We can even look at medications, CBD medications you're taking already, to help you figure out if that's the right product or not. If you're looking to read about the Department of Transportation notice about testing, go on our website, look under CBD Health. It's on one of the subjects in terms of looking at the Department of Transportation notice. It is printed out in there on the link, so that could help you too if you're somebody who's concerned about a person with a CDL license and THC or any other medication that they're testing for. This was actually brought to my attention by one of my patients that I take care of. So we put it on the website because I think it's very important that it actually states that a person with a CDL cannot make an explanation of CBD use as their THC presence in a drug test. So it's very important. I can't stress that more than enough. You do not want to, have a problem because you're taking a wrong CBD medication. I hope this helped. Call us, email us, DM us on Instagram or Facebook. We're here to help. Look at our website at www.backtobasicsllc.com. Our phone number is 401-678-6420. We do free phone and office consultations. We're located in Warwick, Rhode Island. We do that by schedule only. So we're just here to help. Thank you again for your time.